So I have sadly just terrible news for you today. The United States trajectory of new cases since we got our first 100 cases is the worst in the world, bar none. Okay, so I'm going to go through a few bits of data with you today. The way things are going, we are going to be in a nightmarish dystopia that will make this week and the hundreds of deaths this week not seem that bad. So before we look at this, I want to first update you on the official numbers. Understand that it's been an hour since I grabbed these numbers, so they've already changed. They've already gotten worse. But as of probably by the time you watch or listen to this a few hours ago, as of this morning, the United States had 68,000 official cases, 68,000 official cases. The real number of cases, of course, is probably between 4 and 20 times that. So we're looking at anywhere from, 275,000 cases, 1.4 million cases. We really don't know because we aren't testing. We are backlogged on testing, and a lot of people aren't being tested at all. So we just don't know. But the official case number, there it is. In terms of the states, New York currently has just under half of the whole country's cases. Other hotspots are New Jersey, California seeing a big increase. Washington State has had a lot of cases. They are getting it under control there. It spiked earlier in Washington, as many of you know. And then you've got a bunch of states right around 2,000 official cases: Michigan, Florida, Illinois, Massachusetts, Louisiana. And then you've got another tier in Georgia, Texas, Pennsylvania, Colorado. At every state has some cases at this point. Now, of course, the United States is a different sized country than others. We're a large country geographically. We're also a large country in terms of population. We've got about 340 million people here. With enough land area here, you essentially have states that both in geographical size and in population can be bigger than many individual European countries. So what we need to be looking at, just the case numbers don't tell us that much. We need to look at the trajectory. How quickly are cases and deaths increasing in the United States? When we look at that rate, when we look at how we are tracking, one thing that we look at is after we got our first 100 cases, meaning once you get 100 cases is when you know this is going to be an issue and you've got to start doing stuff. We look at after 100 cases have been reached, how quickly have the numbers gone up? On this chart that we're putting up for you, which I will describe, a steeper curve means a faster increase in cases. So when you look, I've highlighted certain lines to make this easier to read. Cases in the United States have increased more quickly than they did in Spain and more quickly than they did in Italy. Italy is one of the most disastrous and tragic situations around the world. Our cases are increasing more quickly than that. And since about day 19, after hitting 100 cases, we even passed China's level of increase, which initially had absolutely cartoonishly disastrous numbers. So the point is, we started later in that other countries started seeing case growth sooner than the United States in absolute terms in February instead of in March. But in terms of the speed at which cases are increasing here in the United States, we are doing worse than just about every country, and the implications are disastrous. If this doesn't change, and remember, 30 states aren't doing a damn thing to make it slow down, in another 10 days, we are going to have an unconscionable number of cases, an insane number of people hospitalized. The medical system will be overwhelmed. Deaths are going to skyrocket, and hospitals are actually already overwhelmed. Some of the stuff Trump is talking about, ad hoc FEMA facilities, bringing a hospital ship up to New York City, it takes weeks or longer to get that stuff online. So right now, while we're working on a vaccine that's a year away, we're testing large clinical trials looking at anywhere from 4 to there's really 30 or 40 different possible treatments that are being explored. The only tool we have right now is physical distancing and staying the hell home. And Donald Trump is starting to talk about ending it on April 12th and filling churches in large parts of the country. So just do the math as to whether this makes sense. Meanwhile, Germany, while dealing with lots of cases, they are keeping their death rate very, very low. And when this started and the death rate was low in Germany, we thought, well, Germany just hasn't gotten that many cases yet. The more serious cases are going to develop. The death rate is going to go up. Germany now has nearly 40,000 confirmed cases and only 222 deaths as of this morning. Still tragic, 222 deaths, but it's a death rate of about half of 1%. That's very good compared to what we're seeing in a lot of other countries. The question is why? One thing is their medical system is not yet overwhelmed. Number two, they started testing earlier, so they have probably a closer to accurate assessment of the number of cases. Still not totally accurate, but closer than the United States. We know, and Dr. Isaac Bogosh told us earlier this week, the outcomes are much better when the system is not overwhelmed. The earlier and the more that you test so you can quarantine people, the better you're going to do in terms of preventing that medical system from becoming overwhelmed. This is the point of social distancing. This is the point of flattening the curve. Given 100,000 cases in a month versus 100,000 cases in 6 months, you prefer it in 6 months because it keeps the hospitals less full and therefore the outcomes are better. Meanwhile, we have a president who wants to go in the other direction and let her rip on April 12th. I'm getting now dozens of emails daily from people in the Netherlands saying we're fully shut down till I think they said June 1. Canada saying, our briefings from Trudeau, he's by himself versus Trump still talking about social distancing and up on a dais with a crowd of people in a room full of reporters. People are emailing me saying, I'm so sorry, David, that you're dealing with a country that is doing seemingly the opposite of what many other countries have figured out. It's very, very bad. Let's take a quick break. After the break, we will talk about who do Americans trust when it comes to the virus. You might be surprised or maybe not. We'll also talk about 5G conspiracy theories exploding now that they can be interlinked with coronavirus. Those stories and more coming up right after the break. I'd love it if you checked out a YouTube channel we're partnering with. Their content is great and they're good friends of the David Pakman Show. The channel is called Upflip and you can get there at davidpakman.com/upflip. Make sure you subscribe when you're there. If you own your own business, if you're thinking of starting one, if you're interested in entrepreneurship and building companies, as many of you know I am, I think you will love this because every week Upflip gives you sort of an inside look at a successful small business. How did the entrepreneur do it? How was it built from the ground up? The stories are inspiring. I always love learning about how business owners got to where they are. And they share a ton of wisdom about mistakes, what they learned, really great insights. And Upflip uploads new videos every Wednesday featuring a totally new business. Check it out at davidpakman.com/upflip. Link is right down below underneath this video. Subscribe to their channel and click that bell icon to get notifications.